Apollo 11 pilot Buzz Aldrin once said, "Fighter pilots have ice in their veins. They don't have emotions, they think, anticipate." Some of the same could be said for airline pilots whose decisions impact the safety of countless passengers every day.
From long lines at security to bumps that can happen once you're off the ground, for many of us, the thought of flying can be stress-inducing.
But for some pilots, they often keep the stress of their job or personal lives to themselves out of fear of losing their wings. One study reported nearly 27% of pilots acknowledged withholding information about their mental health, and 56% avoided accessing needed health care out of fear of losing their medical certificate.
We take a look at the stigma that some say has led to a culture of silence among pilots and the efforts to break down the barriers for aviators to get help for mental health. October 22nd, 2023.
Yes, we need law enforcement.
Alaska Airlines Flight 2059 from Everett, Washington to San Francisco diverts to Portland, Oregon after an unthinkable mid-flight incident.
What was the highest level that occurred? It escalated to a 4.
A level 4 threat, the highest possible, signifying a breach in the flight deck. That threat from a man who Alaska Airlines said had clearance to be inside the cockpit.
It seems like he settled down as soon as he, after one moment of going a little bit overboard.
Court documents allege off-duty Alaska Airlines pilot Joseph Emerson was riding in the cockpit jump seat when he said, quote, "I'm not okay," and attempted to crash the plane by shutting off its engines. In a statement, Alaska Airlines said engine power was not lost, and the captain and first officer responded quickly. The flight crew relayed updates to the ground as the harrowing situation was de-escalated.
Threat is now in the back of the airplane, so we're reduced on the threat level.
According to court documents, Emerson told federal investigators he believed he had a nervous breakdown. He also admitted to police he had been dealing with depression and had not slept in 40 hours. He also talked about trying psychedelic mushrooms for the first time.
And so this can result.
University of North Dakota neurologist Dr. William Hoffman did not treat Emerson, but he says airline pilots face tremendous pressure on the job and often compartmentalize their personal life.
The type of person who is willing to be at 35,000 feet and have complete responsibility for 250 people over the North Atlantic, and at any moment be ready for an engine failure, a hydraulic failure, a medical emergency, and a bad weather storm, may not be the same type of skill set that will easily raise their hand and say, you know what, I think I might need to step away to get some help.
Dennis Tager, an American Airlines captain and a spokesperson for its pilots union, says pilots not only cope with high stress on the job, but a difficult lifestyle that often forces them to go at it alone.
The pilot profession is really a lonely profession. It's a rewarding profession, but you're out on the road a lot. It puts stress on family and personal things that other professions, many of them don't have. It's always been that way. We don't talk much about it, but we know internally that stress.
A culture of silence that research shows is fueled by fear of losing their wings if they speak out about their mental health. A 2016 study published by the National Institutes of Health found hundreds of airline pilots are managing depressive symptoms and possibly afraid to seek treatment due to the fear of negative career impacts. Pilot and former NTSB Vice Chairman Bruce Landsberg echoed those concerns during an NTSB panel discussion on pilot mental health in December of 2023.
Our son lost his life due to post-traumatic stress. So I understand this firsthand. I'm also an active pilot, have been for much longer than I will admit to. But I voluntarily grounded myself and took advantage of some counseling. Did I report this to the FAA? No, I did not.
The FAA says it relies on pilots to self-report any mental health issues on their medical certification form, which an aviation medical examiner will consider when deciding whether to allow a pilot in the cockpit. In a video statement posted on its YouTube channel, Federal Air Surgeon Dr. Susan Northrup says the agency is trying to remove stigma from encouraging pilots to open up about their mental health.
Through our educational and outreach efforts, we have attempted to dispel the myths. A mental health diagnosis is not a career ender.
Bipolar disease, personality disorder, psychosis, and substance use disorder automatically bar a pilot from obtaining a medical certificate. The FAA adds it updated its guidelines in May 2024 to allow pilots to be treated with Cymbalta, Effexor, and Pristiq, all medications that doctors say can be used to treat anxiety and depression. In his research, Dr. Hoffman found the decision to open up about their mental health versus the potential financial losses of losing their wings and significantly impact pilots.
This paradigm can at times leave some pilots weighing the risks of stepping away or disclosing health information against the risks to their career. How bad does mild anxiety need to be for the potential walking away from flying for 6 months or longer?
As for Joseph Emerson, Alaska Airlines confirmed he completed his FAA medical certifications, and at no point were his certifications denied, suspended, or revoked. Emerson was relieved of his duties at Alaska Airlines and was criminally charged, but he pleaded not guilty and was set free on bond in December of 2023. Emerson's wife Sarah told reporters she believes one good thing could result from her husband's case.
I'm saddened that this situation had to happen to my husband and to these people that it affected, but I know that this has created a movement and momentum to help thousands of other pilots.
We reached out to the FAA, who said it couldn't comment on Emerson's case. The agency did tell us it's committed to prioritizing the mental health of pilots, and it created the Aviation Rulemaking Committee, or ARC, to address this issue. In April 2024, ARC released 24 recommendations, including creating a non-punitive pathway for disclosing mental health conditions and treatments. The FAA will determine the next steps after reviewing those recommendations.